Let's get started. Quick revision on bronchiectasis. So let's understand the term bronchiectasis. Bronchos means airways, ectasia means dilatation. It can be defined as abnormal dilatation of the bronchi, or it can also be defined as a permanent dilatation of the airways. Bronchiectasis is not a disease, rather it represents the end result of a variety of pathological processes including many systemic disorders. Bronchiectasis is caused mainly due to congenital diseases like cystic fibrosis, ciliary dysfunction syndromes, or primary hypogammaglobulinemia, etc. Or it can also be caused due to acquired diseases like pneumonia, primary TB, inhaled foreign body. These three diseases are mainly seen in the children, or in conditions like suppurative pneumonia, pulmonary TB, asthma, bronchial tumors. These diseases are seen mainly in the adults. Pathophysiology of bronchiectasis. It includes three important elements, that is infection, inflammation, airway damage and obstruction, that is the enzymatic actions which is taking place. When there is infection leading to the inflammation, then again inflammation leading to the airway damage and obstruction, again it leads to the hampered local immune response and back to the again secondary infections. So now let's understand in detail how the bronchiectasis occurs. Once the pathogens, that is bacteria or fungi, gets infected to the lungs, it leads to the inflammation of the lungs. The inflammatory cells produces proteases which causes lung destruction, impairment of the lung defenses. The inflammation which occurs in the airways will be transmural inflammation. So once these pathogens are in the airways, they get colonized in the airways with the formation of the microabscesses. These pathogens, they also activate the receptors present on the surface of the cells like macrophages, neutrophils and lymphocytes. Due to the stimulation of the mucus producing glands in the airways, there will be also increased production of the mucus. Once the inflammation is set in the airways, there will be thickening of and the fibrosis of the airway walls, and the cilia which are present on the airways also gets damaged. So due to the destruction of the cilia, there will be also destruction of the cartilage which are present in the walls. So once the cartilages are being destructed, the bronchi or the airway gets dilated. This is known as bronchial hypertrophy. Now the bronchial arteries which are present in the airways, that is bronchi. So once the bronchi get dilated, these bronchial arterioles also gets enlarged, that is submucosal bronchial arterioles also gets enlarged. Usually these bronchial arteries are very thin, they are less than 1.5 millimeter. Once its caliber exceeds, that is more than 2 millimeter, there will be significant hemoptysis is seen, that is mainly due to the secondary infections. Now let's understand the types of bronchiectasis. Clinically it is been categorized based on the damage happened to the airways. So it is of three types. First one, cylindrical or tubular. It is the most common and least serious. Smooth tubular configurations are seen. Second type is the varicose, irregular contour with alternating dilating and contracting lumens are seen. Third one is cystic or saccular. This is the most severe form. It exhibits saccular dilatation of the bronchi. Sometimes it can also be categorized as focal or diffuse. Focal is nothing but occurring in the one area in the lungs. Diffuse is nothing but in many areas throughout the lungs the bronchiectasis are occurring. Next, let us understand the clinical features of the bronchiectasis. There will be sputum production and long-standing cough. If there is no sputum production with no or less hemoptysis and dry cough, that is nothing but the bronchiectasis sicca presentation. Hemoptysis generally we are seeing in the bronchiectasis patient. Breathlessness will be present, chronic rhinosinusitis and reduced smell, and due to the chronic cough, long-standing cough, it can lead to the urine incontinence. Usually there will be history of repeated infections, tuberculosis, pneumonia, etc. diseases. On examination of the bronchiectasis patient, on chest examination, there will be typical and early and mid inspiratory as well as expiratory crackles are heard with or without wheezings. Then clubbing is seen, weight loss presentation is there, low grade fever is seen. Investigations for bronchiectasis. On chest X-ray examination, bronchi with thick walls, that is dilated bronchi, as I have earlier explained, bronchial hypertrophy. So on X-ray we can see tramline shadows, paraline shadows, and ring shadows are used to describe these bronchi. Tramline shadows are nothing but the short arrows, then ring shadows are nothing but the long arrows we are seeing on the bronchi. Next is the high resolution computerized tomography. This is the gold standard investigation. It mainly helps us to know the type of bronchiectasis. Next is the sputum examination. It reveals the Dietrich plugs. These Dietrich plugs are nothing but minute foul smelling masses of bacteria, granular debris, and fatty acid crystals are found in the sputum. These are quite fetid. Next is the complications of bronchiectasis. Usually recurrent chest infections can be seen, acute and chronic respiratory failure, cor pulmonale, septic embolism, secondary amyloidosis, hypertrophic osteoarthropathy, malabsorptions, etc. Hope this was quite helpful and had a quick revision on bronchiectasis. Do like, comment and share, and follow KK Homeo Hub for more such informations. Thank you.